Good afternoon, everyone. My name is Ray Prathi. I'm a member of the board of the Canadian Pulmonary Fibrosis Foundation, but perhaps more importantly, like so many of you in this room, I suffer from IPF. And I find these sessions just enormously important, not just from an educational perspective, but also, frankly, for my own personal mental and emotional health. And for that reason, I would really like to thank Fran and Maine from the BC Lung Association for the work they do in putting these sessions together. I think it's a great job that they do. So thank you. I've just got a brief presentation that I'm going to run through quite quickly about CPFF. If any of you want more information, then I'd simply encourage you to go to the website, cpff.ca, and you've seen some of the swag that the foundation has provided outside, so please feel free to use as much of it as you can. Breathing should never be hard work. That's the kind of motto that we think about all the time. Pulmonary fibrosis is under the radar, even amongst most doctors, and we heard already this morning how challenging it can be for accurate diagnosis. It's invisible. Patients often feel unseen. It's life-altering for caregivers too, and we had an excellent chat already this morning from a caregiver. Breathtaking. Oxygen access is inequitable, and I'll come back to that for a second because it's one of the issues that we're working hard on at the foundation. It's deadly, unfortunately. And more so, most people don't realize this is more deadly than most cancers. We've been hard at it since 2009, and we feel that we're one of the important voices for more than 30,000 Canadians that are living with pulmonary fibrosis. Our vision is ambitious. We like to see a world free of pulmonary fibrosis. Our mission is we want to provide support through support groups. We want to lead advocacy work on behalf of all IPF people. We want to raise awareness. And very importantly, we want to fund research. And I'll come back to that quickly. Got started as a private foundation by Robert Davidson in Toronto, an IPF sufferer and a lung transplant recipient. And let's move on. In 2010, website was launched, and the first research grant was awarded. 2011, another $50,000. In 2013, we began with Hope Breathes Here, which is our motto. We've got, in 2019, as the foundation progressed, we established 4 pillars. One for patients and caregivers, one for education and awareness, a third for research, and a fourth for advocacy. And those 4 pillars are what drives the work of the foundation across the country. For patients and caregivers, we know PF is invisible and is life-altering. So we have helped establish and support 23 support groups across the country. We have 2 here in British Columbia, one that Fran stewards for us in Vancouver, and another one by Dr. Holly Smith, who lives in Ladysmith on the island. And there are 21 others across the country, and the number is growing. We have a patient guide. We have an app. We have an extensive web presence. And we're on Facebook. A lot of people approaching us and communicating through Facebook. We're supporting patients and caregivers. We don't have that audio, so I'll have to move on. Education and awareness. as we heard today, how difficult diagnosis is, it really is still under the radar for MDs. So we publish patient story videos. Some of them focus on just how challenging was it to get an appropriate diagnosis. Doctors, we have doctors explaining the videos on our website. We've got an extensive PF resource library on our website. And we have a series of educational webinars, and the number of those webinars is growing. And then we have a variety of public awareness campaigns. September is always a very big month for us, where we try and focus awareness right across the country through various media-related events, walks, and fundraising events. Research, which is a near and dear issue for me, because it is more deadly than many cancers. We have fellowships, and you'll be interested in knowing that 3 of the doctors who spoke to us today have all been recipients of fellowships from the CPFF Foundation that studied here in British Columbia, and all, by the way, mentored by Dr. Chris Ryerson, who's going to be speaking to us at 1:30 this afternoon. And these, I know from talking to the doctors who've had the research fellowships, how important it has been to them to develop their understanding and their own research work on PF. That's a very important part of the work. We also do research grants for specific pieces of research that get done. We spent already over $2 million in the last, that's over about the last 6 years. Advocacy, very important part of the work that the foundation and the board does. We do a variety of surveys in order to make sure that we have a substantial enough base of information to go off and see ministers and public servants to advocate on behalf of public sufferers of pulmonary fibrosis. We have, when elections are held in provinces in particular, we have educational toolkits that are available, because we encourage all our volunteers to go out as much as they can to speak and advocate on behalf of sufferers of pulmonary fibrosis. And we're nonpartisan. We speak to all parties. We have a patient charter which guides our work. And we have been focused in the last 18 months in particular on the issue of oxygen, because as we've discovered through our surveys and our discussions with pulmonologists and respirologists across the country, the access to oxygen is really dramatically inequitable and dramatically uneven across the various provinces. So a lot of our advocacy work in the next 12 to 18 months will be meeting with provincial ministers, ministers of health, and senior public servants to see what we can do to improve and make more equitable access to oxygen. That $1 billion number that you see there is very important. The federal government announced about 18 months ago that it would provide $1 billion to provinces to improve access to drugs for rare diseases. They have provided little guidance since then, other than we have established that the billion is in the so-called fiscal framework, so it's there, and they're about to start allocating it across to the provinces. We're going to focus on 3 provinces, Ontario, Quebec, and British Columbia, because they're going to get the bulk of the money amongst those 3 provinces. We're working with other groups that represent rare diseases, because it will be up to the provinces to decide what exactly is a rare disease and what drugs they might want to make more easily accessible. So our advocacy works over the next 12 to 18 months is going to be very much focused on that $1 billion number that you see there. The impact we have, September is a big fundraising month for us. Last year, we raised $111,000. The early returns from September indicate that we'll be substantially above that number. I'm not going to, this is a busy chart. I won't go through the rest of it, but you can see some of the impacts that we have been having over the last 12 to 24 months. this is our board. I'm thankful that we have 3 representatives from British Columbia. I live in Victoria. Dr. Holly Smith is on the island, and Valerie Pringle, who's the treasurer of the foundation, lives in Whistler. So British Columbia is well represented on the board. And we have a medical advisory board that guides us in, particularly in our research grants and fellowship decisions. And you'll see down at the bottom right-hand corner, Dr. Christopher Ryerson. Dr. Ryerson will be speaking to us at 1:30. He's an absolutely essential part of the work of the Medical Advisory Board. And as I say, critical in the mentoring of the research fellows, 3 of whom you've already met today. And we have a very small team, essentially 2 full-time employees and then others under contract that do our work. Though we have a very ambitious plan over the next 3 to 5 years to substantially advance the work of the foundation. So thank you very much for listening to me. Please go to cpff.ca if you want any more information. But we are always looking for board members and for volunteers. So if any of you are interested, please let me know, or let Fran know, or Men know, and we'd be delighted to have you on board. Thank you very much.